No patient should ever, when they're thinking about the lap band and they've made a decision to have one from a medical and a weight loss perspective, no patient should ever think of finances as being a stumbling block. One of the beautiful things about the success of the band over the last 10 years is that commercial insurance carriers have embraced the impact and the positive effects they've had on their patients, so that they are more and more starting to cover that. When Medicare and TRICARE came out to say that they would cover the lap band and cover these types of surgeries, a lot of the other insurance companies embraced that approach and have started to cover it.
Most of our lap band patients have commercial health insurance that pays for the surgery, or at least most of it. Some patients have Medicare, which does actually pay for lap band surgery, provided it's at a center of excellence, which we are. And some patients have to pay out of pocket, and to help those patients, we work with several financing companies that make it a very reasonable monthly payment for patients.
It turns out that it's only the minority of patients in whom the insurance company will not cover the cost of the surgery, in which case the patients end up having to pay out of pocket for it. Luckily, my practice and many other practices around the country have relationships with third-party financing organizations like Care Credit, and Care Credit will help the patients spread their payment over a period of years, where it's usually about the same as a car payment every month. So it makes it, fairly affordable.
Allergan has actually done a wonderful job by providing a 1-800 number, 1-800 lap band, to help you to navigate across those waters and figure out whether your insurance companies cover the bands or not. Finally, most practices do have a self-pay price. We obviously try to keep that price as low as possible, and the other thing that we do with our self-pay price is we recognize that the surgery is not just a standalone item. It always has to be done in conjunction with aftercare. So therefore, our self-pay price bundles in the cost of both a year's worth of aftercare as well as the surgery itself, so that you don't have to worry about paying each time you come in. You can come in as much as you need to have that band adjusted and to be successful along your journey with your lap band.